Greetings, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Bright Spots Ventures. We are dedicated to accelerating innovation through content, communities, and meaningful connections. And our mission is simple: to spotlight what's working in healthcare and help all of you figure out how to scale it. We bring leaders together from plans, hospitals, and other healthcare innovators around the land to share proven strategies that drive measurable impact. Through this podcast, our private executive councils, our private in real life events, and our go-to-market strategy work, we surface and amplify the bright spots in healthcare. See how I did that with the name of the show? These are proven innovations that others can learn from and replicate. At our core, we exist to foster trusted relationships that we do at scale that fuel your progress, because we believe the best way to improve healthcare is to find what's working, find a bright spot, and clone it. Please subscribe to this show. Probably if you're listening to this right now, you are a subscriber, but if someone referred this episode to you, I encourage you to subscribe and rate the show so that more of your peers can find this podcast and learn from all the great leaders that have come on it, like today and recently in the past, that help them help their organization provide better healthcare to all of us. All right. Today's episode takes on one of the most important but overlooked functions in healthcare, and that is credentialing. It's the backbone of provider network operations, compliance, and trust. Yet often, it's too slow, right? It's manual, often misunderstood. So we're calling this episode, at least at the point that we're recording this, Inside Credentialing, where AI delivers measurable ROI for health plans. I want to thank our partner, Verifiable, for supporting today's episode. If you have not heard of Verifiable, they are a credentialing and networking monitoring platform built to help your organizations optimize operations with error-free, fast verifications and to stay compliant with ease. Backed by their in-house NCQA certified credentialing team that bring a combined 60 plus years of experience, Verifiable's innovation supports managing trusted networks at scale through 97% verification automation in seconds, with millions processing each month. Their team works with leading healthcare organizations such as Humana Dental, Zealous, Talkspace, Headway, Empower Pharmacy, and many, many others. And you could learn more about them at verifiable.com. I'm going to spell that for you guys. It's V as in Victor, ERIFIABLE, verifiable.com. So thanks to those guys for supporting Bright Spots in Healthcare. So here's how I wanted to frame things for everyone. I was thinking about the last time I renewed my driver's license. All of you could remember the last time you renewed your driver's license. You either filled out a form digitally or actually paper. You waited in line. You double checked that every form was in order, all to prove you're still qualified to drive. Now, imagine if every state had a different process, half the records were still on paper, and the database that stores it all only updated like once a year. That's what credentialing often looks like inside our industry. Every health plan, every state, every provider network running its own version of the DMV. Oh, I've got a headache just thinking about it. It's accurate, but it's painfully slow. And when delays, they pile up, they ripple across the entire system from the provider onboarding process to access for all of us patients. So the good news here is we have a new wave of automation and AI that is streamlining the process, replacing the paperwork shuffle with connected, intelligent verification. So today, we've brought together three really innovative, smart leaders who have been at the center of this charge, people who have seen firsthand how to modernize this critical but often overlooked part of healthcare operations. They're here to help you understand how foundational infrastructure like credentialing is being rewired through the automation of AI and what that means for efficiency, trust, and responsible innovation across our entire ecosystem. So, joining me today in alphabetical order by last name are Sandra Clarke. She's the former Chief Financial Officer and Chief Operations Officer of Blue Shield of California, and she's a board advisor to several different healthcare organizations. We have Janan Dave. VP of Operations at Verifiable, and Brett Dooies, Head of Product at Verifiable. And together, they're going to bring some operational, technical, and leadership perspectives on what it really takes to turn credentialing from a compliance burden to a strategic advantage. I want to repeat that because it's really important for the theme today. Instead of it just being a table stake and a burden, we're going to talk about it being a strategic advantage for your organization. Because when you think about it, credentialing is the quiet infrastructure of trust in our industry, right? The DMV, we never see it. We never really think about them, but we depend on them every day to drive around and make sure that the system is moving safely, even when we're not thinking about it. So, Sandra Clarke, I'm going to bring you in first. As we enter into this next era of healthcare transformation, where like every function is being re-examined through this lens of efficiency and risk and trust, like I mentioned, how should plan leaders think about the foundational processes like credentialing, and why can like something that's often viewed as back office table stakes become a major source of both risk and competitive advantage?
That's a lot. Hi. Nice to see you, Eric. And let's start with, I became connected to Verifiable because I have had an experience with credentialing as a leader at Blue Shield of California, and it raised awareness for me of a function that often doesn't get to the C-suite level in terms of its importance for our ongoing operations. And I was so excited by what Verifiable is doing that I agreed to do some advisory work for them. So full disclosure there. You laid it out really well, and I wish that someone had used that DMV analogy to me many years ago to understand just exactly how important credentialing can be. It is table stakes, and for a lot of executives in health plans and probably in provider systems, they just assume it's getting done because it has to. It's part of your compliance infrastructure, and if you don't have credentialing up to date, it's in essence your license to do business. You are not able to then allow those doctors to see patients who are members of your plan, and that creates a lot of friction and a lot of problems within the system. So understanding how critical it is and how manual and intensive the work is now is the first step. And then you can look at what are your options to automate it. Everybody's looking to automate whatever they can these days within the administrative infrastructure of a plan. You're looking to reduce as much unnecessary, I'll call it busy work, as possible so that you can focus people on really assisting members and providers in a direct way to make certain that things are being done in a cost-effective and efficient manner. So if you don't have your credentialing as a well-running machine, you can end up with some pretty significant problems because once you have a backlog in this process, I used the analogy not long ago that it's like quicksand. You get stuck and it's really difficult to pull yourself out because the process takes so long to complete, and once you're behind, more and more is building up, and it takes so long to get out from under it. So it is important to be examining this from a lot of different lenses. And last thing I would say is that the typical answer when you run into a challenge with a transactional process is that you look at licensing or you look at how you solve this with third-party solutions, meaning throw more people at it from external organizations. And then potentially you look at building something internally. And we can talk about that, but it's not where I would recommend that you go in terms of a solution in either case.
Makes sense. I love how you just sort of set the stage there for how strategists should be thinking about this. And I'm going to now bring in Brett Dooies, who runs product at Verifiable. And don't worry, we're not going to do a product conversation here about Verifiable. But Brett, I want you to come in and talk about how, many of these regional and mid-sized plans, there's exploring like how to bring in AI, right? I just came back from health. Couldn't go more than 5 minutes without AI being mentioned throughout the entire week. So how, when you're thinking about AI and bringing them into your core operations and like credentialing, From your view, like what are the most practical ways that plans could begin using AI in this space, and how should they think about defining and measuring real outcomes before making an investment? Like, what are the goals? Then what are we going to invest in so that we know that that investment's actually achieving said goals?
Yeah, thank you, Eric. Thanks for having me as well today. I think it's a great question to ask, and you kind of brought up the point. AI is a buzzword. There's incredible hype around it. But the goal of any organization is not just to use AI, right? It's to solve their business problems. And one of the things that I think is worth acknowledging is that the business problems you had before AI became a buzzword are often the same business problems you're trying to solve today. And the question is this tool going to help you solve them in a new way that's better than the old ways available to you? Sometimes it feels like AI is sort of like a hammer looking for a nail. And I'm sure a lot of the listeners today were, exposed to the recent story from MIT that they published that estimates 95% of AI investments in corporate settings in the last year failed to demonstrate a return on investment. So as you look at that, you think, what is the right strategy for proving out return on investment, for actually picking a use case where this technology will have an impact that we couldn't previously have? So much like the theory behind the Bright Spots podcast, 95% of those cases didn't prove ROI, 5% of them did. So I think the question is like, what is the characteristic of those 5% that made them successful entry points for AI? And that's where we really see credentialing as a really good entry point for organizations to start leveraging this technology and actually proving its worth because of the characteristics of the process and what problems you're trying to solve as an organization. So to go into a little detail on that, credentialing is a pretty structured and pretty rules-based process, but the devil's always in the details. And there is a lot of variability and nuance in the sub-steps of those processes, which makes it kind of perfect for the kind of targeted automation that we can start to create with AI systems. Additionally, there's sort of two competing priorities in credentialing. There's obviously a high burden of compliance, but there's also a high interest in efficiency, right? We just heard Sandra talk about the fact that everyone's looking for those efficiency plays in the administrative area of the organization. And so thinking about those two things together, how does technology allow you to maintain or even improve compliance while also improving efficiency? So with credentialing, we see that opportunity. We see there's limited risk from a patient-facing perspective. There's an established process. There are folks who can sort of monitor this, experts in your organization who can verify that as the process is working, it's actually working and proving ROI. And then you hopefully have benchmarks that you can actually compare to as well in terms of what it looks like today. And if you don't, that's the place to start, right? When we talk about measuring success, things like turnaround time for those actual credentialing events. Do you have a backlog that's building up? Are you maintaining pace with the amount of volume that's coming in? Those are things that you already know today, and you can actually set clear goals. We want to see a reduction in that turnaround time by 75%. We want to clear out our entire backlog within that first quarter of implementing a new solution that is technology-based and leveraging those AI foundations. So I think that's why I see this as such a good entry point for proving out the worth of this investment.
Okay, I just want to make sure so the two big goals that I heard you say, I want to make sure I caption them right. Turnaround time, right? So that makes sense. And then I'm going to call it like your backlog clearing out percentage.
Yeah, and not everyone has a backlog, but if you find yourself in that situation, like Sandra and her organization did, she kind of called out the point that throwing bodies at the problem, one, may not be effective because there's a ramp up time for those people. There's training, there's enablement to actually get them going in the process. So it's not an instant solve anyway. But two, that creates this sort of like uncertainty and expansion and contraction process in the organization and the ways it's using its resources, right? And no organization likes that kind of uncertainty from a business perspective, from a budget perspective, and definitely from a people perspective. So that's where investing in the right technology that can actually scale with your volume, scale to make sure that you're performant over time, whichever way the business goes, limits the impact to the people involved in the process.
And just to build on that for a second, Brett, the backlogs in many respects can feel inevitable in any organization because you can never staff to peak in any function or task. So the question then is, if you're going to solve things, as I said, with people all of the time, you're going to put yourself in that situation unless you staff to a level that is not financially sustainable. So it becomes just a self-fulfilling cycle. So I love your point that it's looking at problems we've already had, and now how can we use AI and apply a different approach to solving it, as opposed to continuing the definition of insanity and expecting we're going to get a different answer from doing the same thing over and over again. And thank you for citing the MIT survey. As an alum, it does my heart proud.
Awesome. Great institution to call yourself an alum from. That's awesome. And I mentioned sort of like it's a hammer looking for a nail. It could be. But in reality, having worked with this technology for a few years now, I think what we're really looking at is a nail gun, right? It's not the same thing. It can actually do things that a hammer couldn't do for you. It can make you more productive at certain tasks.
Sure. All right. So I just want to make sure that the listeners have this. We have TAT, backlog clearing out percentage. And then also, I assume, and I don't know if you called this out specifically, but just overall readiness for the next audit, right? And
Yeah, that compliance, I sort of mentioned, there's the two things, right? Compliance and speed. Compliance needs to be just as important of a factor in the way that we implement the technology and monitor its success. And so you can't take a dip in that compliance.
Any other goals that we're missing? We got those big three. I'm going to call them TAT, backlog, audit readiness.
I love them.
For folks,
I think there's something around satisfaction. I don't know how you exactly measure it, but you're going to have a very different relationship with your providers if they view your credentialing process as a major hassle and pain point versus one that moves pretty seamlessly. So I don't know what the measurement tool is, but I think it's an important one to call out.
it's almost like a provider relationship or almost NPS score, if you will, we should be looking at, because there's going to be a very powerful but maybe invisible economic factor there.
Yeah. And yeah, it's a great call out. Things like turnaround time directly impact that, right? If the provider's waiting to be enrolled with a payer and can't get reimbursed for their work, they're sitting on the sidelines and waiting for that to happen. And so these things impact provider happiness and satisfaction.
Okay. Let's get into the operation of it all. But before we do, I just want to make sure I got this, and I'll put it in the description, the show notes, folks. The study that Brett is alluding to, that Sandra's alma mater authored, is called MIT, the Internet of AI Agents. They call themselves, as an acronym, I'll come up with it, NANDA maybe. And the name of the document, if you Google it, is State of AI in Business in 2025. I believe it was this summer. I'm going to call it July. Don't quote me on that. But we'll have the link right there for you guys in the show description, so you have it. All right. Janan, that was a long wait, but we got to get into operations, and you're the boss when it comes to operations. So Janan Dabe, she's the VP of Operations of Verifiable. Who's been sitting patiently, chomping at the bit here. So from your operational perspective, how do you balance now automation with human expertise and this judgment that's so required in the credentialing process?
Yeah, no, it's been a great conversation so far. So I'm glad we were able to lay a lot of those goals out. I think it stems really well to kind of how I think about this as well. In my view, you're always looking for the win-wins. Where can tech improve your core metrics and your core outcomes? But honestly, in light of, what Sandra was talking about with the people, your provider satisfaction, but also, of course, I think a lot about our credentialing specialists, these experts in the space that have been doing this work and are very passionate about this work. How do we, let them spend more of their time on the work that's most fulfilling for them? Where can we find kind of those optimizations and those win-wins? And I think, just like Brett was saying, with credentialing and back office operations in general in healthcare, I think there's a ton of opportunity to genuinely build more tech and AI-enabled workflows for teams that are performing these functions that actually improve the quality of their life and their day-to-day, but also, meet those core business objectives. And I think that's been true forever. I think we now just have AI to unlock us even further and kind of think even more beyond our imaginations. But I think practically, when we've been developing, we've always felt that tech is really best suited in a couple of places. I think the first place is where you have really repetitive, kind of rote type of tasks that need to be done over and over again. And in the credentialing process, we mapped out every step of the credentialing workflow and asked ourselves and asked our team members, where is judgment and credentialing expertise essential? And where is the credentialing specialist doing data entry or performing just kind of a rote task that they don't need to use their expertise to perform? And the second area is kind of leveraging your tech to reduce errors and insert some guardrails. So like Brett was saying, credentialing is a pretty well laid out process, but there are variations state by state, provider by provider, and there are a ton of rules for folks in this space to have to memorize. And where can we leverage the technology to reduce kind of the baseline need to memorize for the folks on these teams so that they can spend more of their time on tasks that require their critical thinking and their judgment instead? And I think that approach has been successful for us. And I think a big reason for that is because when setting out to bring technology into the process, we consulted our credentialing team members and our experts and kind of asked them, like, which parts of the work do you most enjoy doing? Which parts of the work feel really cumbersome and, not as maybe worth your time? And the truth is they want to spend their time catching potential risks. We see 20 to 30% of the providers we credential actually do have some concerns. They may have a sanction or exclusion, an adverse event on their license. They may have provided false information that doesn't add up. They may be an expiration date. And our team members want to spend the time on those files, but the truth is they spend an outsized amount of time on files with or providers with messy data, and they can't apply the same amount of time to the risk. So I think we see so much opportunity for the technology to help them almost more effectively triage and spend their time on the providers where the risk lives. Because honestly, when they are catching those potential red flags, surfacing those to folks like Sandra and the teams at the plans, that's what gives them a really strong sense of purpose and fulfillment in the roles that they're doing. And obviously, that's kind of the core function of credentialing, right, is to keep the risky providers out of the system.
Okay, so we're actually covering a couple of things here. First, we're talking about a very innovative way and fairly low risk way of incredibly jumping forward in efficiencies around credentialing. But we're also talking about a really pragmatic approach for all kinds of new technology implementation. And it's sort of like building on what Brett and Sandra just said, and now expanding about what you just said. So we have to, one, recognize that there's opportunities here to carefully implement technology. Two, we want to find, to your point, a repeatable process that fits the goal-setting measurement standards that Brett had laid out for us. So you're looking for repeatable tasks, and then you're able to apply innovative technology, in this case AI, to execute those repeatable tasks, and not only quicker than the human, but also at a higher efficiency or accuracy rate. And then humans could spend more time on those, we'll call them the red flags, the true red flags.
Yeah, absolutely. Yeah, I think we definitely see the experts will always be the experts, and we're going to need them in these processes. But right now, we have clouded their days with a lot of random data and tasks. So how do we leverage the technology to ensure that they can spend their time on the red flags and the most valuable? Valuable.
Could you share like a story or an example of how a plan maybe was struggling with credentialing delays before incorporating new technology, and then maybe what changed once the AI was introduced into the process?
Yeah, sure. So we honestly see a lot of plans that come to us that are, and this makes a lot of sense when we listen to Sandra's story, right? We find a lot of plans that come to us that have accumulated a very large backlog of providers that they have not been able to keep up with credentialing or monitoring those providers for. And in some of these cases, they may have had like a true red flag kind of scenario come to light. We've heard of some cases from customers of ours where, a provider of theirs maybe was practicing. They realized that the license had actually been expired for a few months. They have to pay back hundreds of thousands of dollars because this provider was practicing on an expired license. We also see maybe not as dire cases, but risk sort of living and waiting to become an issue where, you do have these backlogs that have accumulated, providers not being monitored. So you don't even know if you do have some of those red flags like living in your active provider network. And it honestly is really easy to kind of see how they've gotten here. It could simply be, like Sandra was saying, that, you just cannot staff your workforce to peak. It's not financially possible. But we also see a lot of situations these days where groups are acquiring other networks and acquiring other groups. And frankly, maybe whoever they acquired from was not credentialing up to snuff. They've now acquired this new network. You now have a ton of new providers that need to be credentialed and monitored. So in many of these cases, what we kind of see is these groups do have amazing staff, but don't have a lot of tools to support their work and to support the work to go quickly. They are still handling a lot of the license verifications, sanctions and exclusions checks pretty manually. Going out, they may have tools to manage their queues of work, but they're still going out to each state board website, looking up the provider manually, capturing that screenshot of their primary source verification, bringing it into their system of record, and still doing every single step by hand. And so we've absolutely seen the use case where even just offering technology that brings all that primary source verification ability into one place allows someone to run all this stuff in an automatic way, has enabled them to at least catch up within a few months, instead of this now being kind of a couple year endeavor where they also have to grow their staff significantly. And in our case, they can either leverage the tech to use this, but we also, as you mentioned, have an NCQA certified CVO, and sometimes we can help them get through this backlog even faster with our team that's also using the technology.
Yeah, you're like city engineers in some ways. When you were talking, I was thinking back to my dates me a little bit. I'm not going to mention dates, but when I lived in Manhattan, in New York City, and when you think of what you guys do, it's all about like city infrastructure. Because like when there's a small one pipe in my neighborhood, it could back up the entire block, right? And then you have to. Credentialing is works the same way, right? When it flows, everything downstream runs smoother. But when it jams, it actually you feel it everywhere. It creates all kinds of problems, right? So I guess, as I'm thinking about my New York City experience, I'm thinking about one particular incident there. So Sandra, from your experience, thinking really as a strategist, what should leaders consider when deciding how to fix these complex operational challenges like ones you faced in credentialing? How can they make those improvements sustainable?
I think a couple of important thoughts and themes. One is, if you are expecting to completely eliminate humans from the equation, you're going to set yourself up for failure and disappointment. I don't think that's appropriate. I have a friend who said you almost always need a human in the middle on something to do with AI. And I think Janan really highlighted that there are complex issues that you don't want a bot talking to a person to try and solve. So you need to approach it with what's the appropriate piece to automate. And then another thing that we've talked about a bit is, are you trying to just do a lift and shift and automate an existing process, which is, we've discussed, has a lot of weaknesses to it? Or are you really going to relook at how it's performed? And that's what I think this technology does, is it takes the process that you've been using and make sure you hit all the key compliance points and you have the reviews, but it has a different approach which enables it to go faster. So those are the things that, if you're looking at making an investment in a change, particularly one that is more technology based, are you trying to just lift and shift? Are you really rethinking how you do it? Are you keeping people in appropriate monitoring and validation verification spots? And then, are you trying to build this yourselves and maintain it and continue to evolve it? Which is a natural reaction for a lot of companies to do. And I think one of the key things that contributed to those AI projects failing in the MIT study. Or are you going to go out and partner with a company where they are subject matter expertise is front and center, where they have built the capabilities and this is what they focus on doing? You have to be careful with that because you could end up with, no joke, hundreds of point solutions that you're trying to stitch together into your system. And then that becomes a nightmare to maintain. So you have to be thoughtful about it and look at where you have the opportunity to incorporate things that already use some of your core platform technology. And so those are some of the considerations that I would say are key to looking at the best way to implement a change. A third party, as I said, that's extra people will help for a while, at least if you are, it depends on how long your company takes to implement technology. So Janan, you talked about how, if there's a backlog, Verifiable could potentially assist with working that down. That really depends, though, on how long it's going to take the company to go through its process to get the technology implemented, whether to use it themselves or to have Verifiable as their CVO. And that's another factor that you have to think about. What can you do for the interim? Is it better to just go all the way to the final solution, understanding what that does to your timelines? Or do you need something that is interim until you can, as a bridge, until you can get to that final solution? And those are really important because you don't want to assume you're going to make everything better within 2 weeks. And it turns out 10 weeks later, you're still in the same situation or worse. And there are companies out there that can be overly optimistic about the process. And there are vendor partners who can be overly optimistic about how fast they can work through the bureaucracy within those companies. And it becomes a very bad experience all the way around. The other thing that I wanted to highlight that I think is important in terms of why technology can be a better solution in this case, provider directories or provider information. One of the things that I saw, and Janan, you didn't specifically mention it, although you did talk about when provider groups come together, is that experience can create duplicate addresses, duplicate information within the system that for a person to try and sort out, or you've got two Erics that look exactly the same except with two different addresses, and the people time that it takes to sort through that, and the automation can be much more efficient at helping you figure out, do these records need to be merged? Does one of them out of date? And I think it can go a long way toward helping your provider directory accuracy also. So when it comes to the strategic and the long-term benefits that you're going to get out of an investment, what are some of those other ancillary things that you might be able to realize by doing this? I think that's an important consideration as well.
It makes a whole lot of sense. I think I speak for many who say they definitely don't want two identical Erics around. That would be bad for everyone. But I think what you're saying here is one of the things, going back to your analogy at the very beginning when first question I asked you about the quicksand is not careful about how you approach pinpointing these operational clogs, to use my city block analogy. You could potentially put more people on it. If you put the wrong solution on it, you could sort of make the problem worse, just like if you were drowning and then you start struggling a little bit and you start increasing your, accelerating your pace of drowning. So you have to be very tactical and a strategic but tactical, and then thinking about the technology solutions that could do more than just one thing, so you don't start adding to your portfolio of touch points. Great, Brett. Let's think about as we're modernizing credentialing, health plan to health plan. What are the biggest mistakes or blind spots you see, and how can health plan leaders right now who are listening build the foundation to measure value and stay ahead of those risks? Like, what have you learned?
Yeah, I mean, Sandra just gave an amazing answer that really walked through a thought process as a leader at one of these health plans of how do you sort of diagnose what your issues might be, and then how do you approach those sort of strategically in the way that you want to solve them. And that I'll sort of double down on that point, which is if you're not thinking about sort of what your process looks like today, you will likely find yourself in more of a reactive position because you're waiting until it becomes a problem, right? And by waiting until it becomes a problem, you put yourself in a position to not necessarily make strategic decisions, but have to make, sort of like quick decisions. So I think that's one thing that we see is, as people are coming to us with issues, they've sort of already got the issue, right? It's already there, and now they're reacting to that issue. I think as an organization, anywhere around sort of where your compliance and administrative tasks are, you'd really rather position yourself proactively. You'd rather be thinking about, hey, if I do this investment, I know that I'll be able to grow for the next 3 years the way that our organization wants to grow. I know that I'll set ourselves up for that audit next year to be able to say, here's the evidence that we're doing the process the right way. So I think it's really important, first of all, to like not just wait for the problems and only go react to them, right? As leaders at companies, it's more incumbent on us to really see around the corner and make those investments early on. From sort of like the credentialing perspective, I think it's important also that Sandra called out, hey, you could throw bodies at this problem or you could outsource this problem. But she called out also like you can't staff to peak. And so you have to be thinking about how do you actually scale this when you have those lumpy peaks, when you get a new provider network onboarded, when you merge with another company that has a backlog. And that's where, again, I think the technology sort of proves itself out as being able to scale much more nimbly and efficiently and effectively than a people-based solution to this problem. If we think about like the experience of a credentialing team today, they are most likely in a modern healthcare organization still dealing with like a disparate patchwork of systems, dealing with multiple data entry points where they're repetitively entering data or taking it from one system and manually typing it into another, and dealing with sort of all the changing requirements that come along with the regulatory framework that's in place. And so you're asking a lot from the people doing this job. And Janan really highlighted that even with our own team, right? They are being asked to do a wide spectrum of tasks that some require subject matter expertise, some really shouldn't or don't, but they're still having to do them. That makes it a challenging role because even on a good day where sort of things are working the way they're supposed to, it's hard to keep up with the process. As soon as something does happen, an event occurs that causes that volume to spike, that fragility of that system really plays out. Mm-hmm. And so I think when you're measuring sort of your effectiveness today, you should be modeling out scenarios of what would happen if tomorrow we had 400 providers show up at the door because we just, got a new network onboarded. Could we handle that? Could we take that? Because most likely that is going to happen at some point in the next couple of years for most of these plans. That's the landscape we live in. That's the way sort of the systems work today. And so again, building resiliency earlier rather than reacting and having to build it in the moment, I think is really important.
Yeah, I love that. I want to try to sort of create almost a strategy and a blueprint for everyone listening. I think you guys have done a fine job with it. I'm going to package it a bit. There's this strategy or exercise that Jack Welch, the former CEO of GE, when GE was one of the most admired companies in the world, maybe the most admired company in the world at the time, he put his CEOs of his various companies in a room a couple times a year and put them through an exercise where the business was shut down, their business was shut down, and they went through a post-mortem for like, okay, what should we have done differently? But they do it like twice a year to kind of try to identify places that they may fail. And so that we're sort of doing that now because I think everyone who's listening has some risk, is risk averse to some extent, has a little bit, not to be crude, but a little bit of CYA that they have to worry about, right, in their current roles, even if they're in a leadership role. So I want to make sure what I'm hearing everyone saying, I'm going to come to you next, Janan, is this. Where if we implement AI into the credentialing process, could it, or any solution into the credentialing process, can it fail? Well, certainly you just mentioned if there's a spike, have we underestimated the complexity of things? Have we not set out goals of like what is success? That's something we talked about earlier, right? Have we incorporated a check and balance between human and technology? Is the technology fitting into the workflow? Have we complicated things with too many touchpoint solutions? We've heard a bunch of folks from all three of you. You've outlined some of this. So I want to continue with that theme to ensure that everyone listening is thinking about how they could really reduce their risk and be very aggressive and innovative around credentialing here. And so, Janan, Brett outlined a bunch of things. So did Sandra when adopting new technology. From your perspective now, how can AI help separate signal from noise in credentialing, right? Because being attracted to a lot of things that are noise and maybe important, but not that impactful versus the true signals so that you can really focus on what really counts is another place where this could fail if you don't get it, if you don't plan for it ahead of time. So how can teams focus their time where it really counts?
Yeah, for sure. I think, both Brett and Sandra were talking about this, but credentialing involves a ton of data across various sources. And what we see in these really large scale systems, obviously they're ingesting data and taking in data from a ton of different providers and groups, and maybe groups are acquiring all of that. And so I think a huge aspect of credentialing is simply reconciling data across all of these sources and really identifying what's the truth, what's the source of truth, and can we verify against all of that, and identify the quality providers. But honestly, I know I touched on this before, but not every provider that's kind of coming through deserves the same attention. I think we spend historically an outsized amount of time just kind of sifting through all of this information instead of spending the time on the back end of the process, which is reviewing, the results of the primary source verifications once you understand just the core details about the provider. And so I think there's a few areas that I think can see that AI will really help plans kind of separate the signals from the noise. The one is in that more effective triage for the folks that are spending time in the credentialing space. So reviewing applications, reviewing providers, that their basic requirements are met, that there's no discrepancies across different data sources, there's no potential concerns and no potential expirations. And then those kind of low risk providers are maybe queued to a team for a final stamp of approval, a quality check. Whereas where there are kind of higher risk providers that are being caught, those are flagged for a team to really spend a lot of time reviewing the application. But I think even with the tech, the work there can be reduced. The tech can showcase, which fields maybe have discrepancies that need to be reviewed, which primary source verifications have already been managed, where there's potentially a risk that someone needs to dig into. And so specialists can kind of spend time in this way, already having the triage somewhat done for them. I think where we really see some opportunity, but of course this all has to be done very thoughtfully, is that even with technology, there are a ton of steps in credentialing. There's like over 100 steps in credentialing, and it takes a human a lot of time to still go through these. And you are in some ways kind of going one by one through provider, and potentially there is risk living somewhere else. I think one of the interesting things with AI is that we can run a lot of things in tandem and in bulk. And all at once, you may be able to surface some of these risky providers to your teams and make sure that they're spending the time in the right places. The other place I think of is that we have teams making a lot of judgment calls that are not always able to maybe record or write down all the reasons for which they're making certain judgment calls on providers. And a big aspect of credentialing and auditing is that you kind of have to have that audit trail. And I think with some of the technology, with how we see a lot of AI development, there is a lot of explanation and logic as to why certain decisions are made. And a human is also able to maybe review that logic and approve or deny. So I think in those ways, there's a lot of opportunity here for AI to kind of effectively triage and also give the experts a lot of more time to document and really spend time on the risky providers that live in these networks.
Great. I'm going to try to get things, we're going to start sort of closing things up with a few final questions, folks. Final one for you, Sandra. Like, you've talked about how credentialing often operates maybe below the C-suite radar. So important. What will it take for leaders to elevate it as a true strategic priority and move with more urgency towards sort of what I'll call responsible automation?
I'm not sure credentialing will ever be one of the highest priorities in the C-suite. It is very much a key factor in, as we've talked about, compliance and being able to have a smoothly running relationship with your providers in the processing. But it's not cool and sexy like I'm going to do automated prior authorization, or I'm going to have voice technology that listens to the doctor and transcribes into the medical record. So I think it gets attention by being part of a larger strategic plan on how to do some connected, real operational transformation, how you're going to leverage this desire to, as you said, Eric, AI is supposed to be the best thing since peanut butter, according to most of the world these days, and maybe peanut butter and chocolate even. And so how you show that doing this automation around credentialing is a beneficial and necessary piece of a broader suite, and that it can be done with a short-term and impactful realization of value. So are you going to get your payback on it quickly? How many people is it going to allow you to redeploy? Janan was talking about the 100 different steps that you've got a person doing. Well, if instead of having that person do that for 10 people in one day, I can have them go work on more clinical support for people who are sick and need navigation, et cetera. That's going to be much more meaningful. And I also think it becomes a higher priority when something bad happens. So I heard a story a couple of years ago about a physician who had gone through, a number of organizations using somebody else's credentials. And you're supposed to credential your internal medical staff as well. And supposedly this person had gone through several entities and managed to slide by using somebody else's credentials until this person was caught by a more robust credentialing program at a company. And that creates massive risk. I shudder if I had to be in that situation where someone was coming and telling me that, and now I had to go back and look at whether this person had ever actually touched a patient or a patient decision. Unfortunately, you'll get zoomed up to the top of the list really quickly in terms of focus if something like that happens. But if you can come with a story about being part of a broader infrastructure solution and the benefits that you're going to bring that are going to avoid that type of thing happening, it's a much better way to get the attention at that level.
I like that. That's scary too. So if I'm hearing you, one, you got to accept that it's not going to be highest priority in the C-suite. But two,
Right.
What's important to make sure you're communicating and recognizing is you've got, I think you mentioned earlier, Sandra, the provider satisfaction. You've got the integrity of your network, which is essentially your product, more or less, as a health plan.
That's right.
You've got the regulatory risk. You have the resource allocation, right? My words, but how you could, I think you said, deploy resources in other areas. So you have all those things combined that allows there to be what I would call like a trigger to like, hey, let's invest in something that's going to improve this entire process and trickle down through the entire organization.
Yes. Yeah.
I want to ask everyone a little bit about a final bright spot question, which I like doing during these episodes. But before I do, did we miss anything? Is there a particular story or point that any of you want to make before me going to like my final, what I'll call rapid fire questions?
Yeah, I would just emphasize the last point Sandra made, right? credentialing is one process within a broader ecosystem of processes around onboarding and administration of a healthcare organization. So things like roster management, things like payer enrollments, provider directories, all those sort of downstream data heavy processes have to be fed by an upstream, functioning process to start. And so I think it's just really worth making sure that point comes through really clearly, that what credentialing is both a compliance process to ensure practitioner adequacy for seeing patients, but it's also a feeder of information to all these downstream processes that hopefully are connected, right? We're not manually rekeying that data is the goal, but it's the starting, it's the foundation, it's the base for sort of the rest of the processes that have to happen.
That's a really good point.
I want to shut down an entire city block.
Exactly. Yeah. You're going to have to tell us that story after we stop recording. Okay, Eric?
So let's wrap up here. And bro, I'll let you go first. I'd love for each one of you to share one bright spot or a moment that captures what maybe responsible or effective new tech looks like in practice.
Yeah, I'm happy to go first with that. And I'm, as the product guy, like a total nerd, and I know I'm not supposed to talk about the product, but I do get excited by it sometimes. And so I would say what excites me, like a bright spot, definitely, is seeing the impact of a sort of like designed and implemented solution on the actual day-to-day lives of the people who do the job. So the nearest thing to us are credentialing specialists, right? They're the ones that I talk to, my team talks to build systems that help them be more effective. And when we get it right, there's just a lot of satisfaction, I think, and joy, honestly, that comes from seeing someone who, had to do something really manually previously say, wow, you just impacted my day-to-day. I get an hour back every day. That's a super exciting and motivating prospect for me.
Wow. Internal team.
I know. I grew up wanting to build software for back office professionals, and I nailed it. I'm really excited about it.
That's great. I love that answer. Did not expect that one. Janan, how about you? Operations now.
Yeah, mine is similarly like a team win, but maybe a more everyday potential, low risk, low barrier to entry kind of way for teams to test out leveraging more AI in their day to day. On our credentialing team here, we are credentialing for hundreds of customers. We are credentialing over 50 different provider types and all 50 states. So we have as you can imagine, a lot of internal policy documents and SOPs and training guides. I think before all of our amazing tech, we have a lot of this documented to ensure we can train new team members. Team members know where to go when they have questions or they're blocked. And we earlier this year kind of used AI solutions to actually recognize where we had discrepancies in all of our training documents. We have so many of these, we have different owners, and we realized that there were actually, discrepancies in certain rules here and there across our policy documents. So we used some AI tools to help us identify those, revamp our knowledge base, even build like an AI Q&A chatbot so our team members could ask questions, the answers coming from the knowledge base that we have that has been built by our experts. So it's kind of a lower level like entry point, I would say, to AI. But I think for many of our team members that have spent their careers in MSP offices and in credentialing offices, it was a good starting point to kind of show our team and gain their trust and buy-in on where these tools can support their day-to-day work, and get their excitement for this next chapter as well.
Nice. If the good ones are taken, Sandra, you're going to have to be creative here.
Okay. Well, I've certainly read a number of examples of AI doing some really impressive things related to patient diagnoses, identifying things like eye disease, et cetera, that a human may have missed in the person because the AI can look at it differently. But the most impactful and positive example that I can think of was shortly after I started at Blue Shield, and we were implementing different pilots of technology, which involved probably earlier stage AI, not nearly what we have now. But the team went to one sole practitioner in a part of California that doesn't have a lot of doctors. So this person was completely overwhelmed with patients and said, we would like to put in some technology to see if it will help you with transcription of the visit into the medical record, where you can just talk into the watch. And we're going to try and automate more of your claims processing with us and your prior authorization and a few other things. And the doctor was sitting there with his wife and she started crying. And the person from Blue Shield looked at her and she said, you don't understand. He has not taken a day off in 10 years because he wants to spend all of his time with his patients. And then he has all of this pajama time, weekend time, etc., just trying to stay afloat with all of the processing that needs to get done. You are going to give us back a life.
Wow. Yeah.
How'd I do?
Great. That was great. You're telling some great stories today. You're on fire. Thank you all for doing this. This is great. I'm assuming, obviously, LinkedIn is a natural place to reach out to all three of you. I'm assuming you're open to connections there. Any other ways to connect with you, or is the best way, not on a corporate wide, by the way, because I'll make sure I repeat the URL for Verifiable, but as far as just individually, LinkedIn, is there anywhere else?
What's best?
All of you? All right, great. All right. Thank you all. We started today talking about the chaos of credentialing, like renewing driver's license in 50 different states. What AI is doing now is building the interstate system, connecting those silos, smoothing the routes, helping everything move faster and safer. And, I'm thinking about, like, before radar, right? The sailors in the harbor, they depended on lighthouses, those fixed points that cut through the night, the fog, and guide them safely. And I think credentialing is that lighthouse for healthcare. It may not steer the ship, but I think it ensures every provider navigating the system is visible, verified, and safe to approach. Do it right, the entire system becomes clearer, safer, and more human for all of us. And that's what today was all about. I want to thank the Verifiable team again for supporting Bright Spots in Healthcare in this particular episode. You can learn more about them at verifiable.com. You can reach out to me personally. I'll make a warm introduction to them as well. And this way, you can, all listening, use Verifiable to build your own lighthouse within your organization, which is so important right now. I think that is, at the very least, reach out to them and learn more about what they know. As you could tell, they're provided all kinds of great insights and information. To that end, I want to thank everyone listening. We don't take the time with you, the time you spend with us for granted. And we hope you could take the ideas, the blueprints that our three guests today provided and bring them back to your organization to improve how you guys operate and how you provide better healthcare for all of us in this country. We produce this show for you. This is your Bright Spots in Healthcare podcast.